I'm going to stop sharing the intro slide for just a moment. It is 11 o'clock, so we will be getting started on this. So good afternoon or morning, where depending on what part of the state you're in, country you're in. Thanks for joining us today for discussion on how data will move from the member to the insurer. We're recording this discussion and we will post it on our new APAC, REALD, and SOGI implementation page. The web link is at the top of the chat. And I'm getting an echo.
You're totally on mute now, Karen. I think it's Josh here, so Josh, I'm going to go ahead and mute you.
Thanks, Jake. Okay. So we are recording the discussion and we'll post it on our new REALD and SOGI implementation page, which is at the top of the chat. Although this isn't a formal meeting, it's always great to know who attended. So if you can drop your name and organization into the chat sometime during the meeting, that would be greatly appreciated. So I'm Karen Hampton. I use she, her pronouns, and I'm one of the operations and policy analysts with the All Payer, All Claims, our APAC program. And it's at the very top, Curtis. I put it in before everybody joined, and maybe that means you can't see it because it could be that you only see what was joined afterwards. So we will go ahead and add that in again. And again, I want to remind people that we are recording this so that we can post it on our REALD and SOGI implementation webpage. So I'm going to hand it off to Grace to introduce herself, and then she can hand it off to Jake.
Yeah, thank you, Karen. Can everyone hear me okay? Yes, okay. I'm sorry, I'm having like technology issues, so I apologize. Yeah, good morning, everyone. My name is Grace Pava. Pronouns are she, her. I am the operations and policy analyst for the APAC team. I am also the project lead on the implementation of REALD and SOGI data into APAC. Nice to meet everyone and to see some familiar names in the chat. Jake, do you want to go ahead?
Yeah, I'll jump in here. I guess, I'm the only OHA person without the background, so my shirt kind of matches, right? But yeah, so I'm Jake Terrence. I do kind of data quality and informatics around REALD SOGI for the agency now. So I've been heavily involved in kind of the repository, as well as kind of helping other systems kind of implement REALD SOGI. So that's kind of one of the reasons why I'm here, is figure out, how can we help get folks the resources they need, answer the questions we need answered for collecting this data. And then I pass it back to Karen or Grace?
Pass it back to me. So thank you. So I'm going to go ahead and start resharing my screen now. And this is our slide deck for the day. So my apologies that I can no longer see people's faces. If ask questions at any time during this presentation, and I say presentation, it's actually not intended to be a presentation. It's intended to be you all talking about what you're planning on and asking any questions you have, either for us or for others that have the experience implementing it for their own organization. So let's see if I can get to the right slide 2. So we're not going to do a summary of last meeting. Anyone can watch the recording. It's posted on our webpage. I did repost both our email link and our webpage after almost everybody had joined, hopefully. So if you still don't see that, if you joined late, and it may be that you haven't joined yet, but please let us know and we'll be sure and get you that information. We're going to be reusing some of the slides, the first of which is acronyms, because this plays a part in every time we talk. So as a note, today you'll hear me talk about APAC, about equity inclusion, or E&I, and about OHA, which is the Oregon Health Authority. APAC and equity inclusion are both part of OHA. So what I'm attempting to do is, whenever I mean APAC and equity inclusion will have a role, I'm trying to call it Oregon Health Authority. And to separate that out, APAC is responsible for tracking data submitted to APAC, and equity and inclusion is responsible for developing the questions, the potential answers, the skip pattern, and as Jake said, they're going to run the repository that's going to process the data as it comes in. So we each have separate roles, but we also have a lot of collaboration that we're going to be doing. So I will try to refer to that as OHA when I mean both of us. So, oops. So slide 3 is another slide that will begin at the beginning of each. And this is just a reminder that while the REALD and SOGI questions and potential answers are set by equity and inclusion and will be provided to you all, and then at the very end, files are going to be sent to APAC, and we're going to share those with equity and inclusion for processing. In between those beginning and end points, a lot of stuff needs to happen, and it needs to happen at your organization. So that's one of the reasons that we want to have these discussions, and I'm planning on reusing this slide, is because I just want to acknowledge how much unknown is happening between the start point and the end point. So today's topic broadly is how will the ask to members occur? So equity and inclusion have adopted, and they are still modifying in current rulemaking, the required template of questions, including potential answers. That's the link, that is the phrasing and the order of the questions and the potential responses of each. So the data side is set and being modified based on the latest information for race and ethnicity, as well as the inclusion of sexual orientation and gender identity, which I've been calling SOGI already. But that's just like the starting point. So we need to talk about how your organization is going to be contacting not only subscribers, but also members to request completion of the REALD and SOGI information. And the next slide is about the mechanism for them to send it to you. This is really about how are you planning, or what are your questions or concerns about doing outreach to your members to obtain the information. So does anybody have ideas or questions on that this morning?
Karen, just before we get into Antoinette's question right here, I just want to acknowledge that Chris dropped in a question in the chat. Does this currently apply to CCOs? Do you kind of want to speak to that?
Yes, so whether or not it applies to CCOs. CCOs, as contractors of the Oregon Health Authority, are required to collect and report REALD and SOGI data. So that is one answer. The other part of that answer that we are still resolving with equity and inclusion is whether that will be submitted to APAC or it will be submitted directly to equity and inclusion. And that really is about the timing of it. We would be able to get the data more quickly if it gets submitted through APAC and then is passed to equity and inclusion. So CCOs absolutely will have to collect this information as contractors of the Oregon Health Authority. When and exactly how, we hopefully will know within the next 2 to 3 months and be able to share that information more thoroughly. And Antoinette's question?
Yeah, hi, this is Antoinette from Cambia Health. I did participate in the OHA RAC for the REALD and SOGI data collection, and I think there may have been a misunderstanding. I did receive the OHA's updated update and resource guide yesterday, and it appears that insurers that have 5,000 plus members are required to report the information January 2025 via APAC, and all other providers and insurers are to do that through the data system that the OHA will create once a vendor is selected, and they anticipate that data reporting to occur late 2026 or early 2027.
Mhm.
To my understanding, I thought we fell, or most insurers, because I think most insurers have more than 5,000 members, fell under the latter reporting once the data system had been created. My concern with the reporting effective January 2025 is that it would not give insurers enough time to, number one, set up systems, because I know all of this will probably be automatically generated to our members, and have an implementation in place and actually reach out to our members for the data to be ready to provide it in January 2025. That is my biggest concern right now. And we know that these rules are not going to be probably effective until July. That's the targeted date. All the insurers maybe can start the work in advance. I mean, in a way, we don't want to do that in the event that these questions may change after the hearing and before the rules are adopted. So that January 2025 reporting date really, really concerns me.
So Antoinette, I absolutely agree with you. I think that that is well stated. We're having, as we say, and we haven't created our own rules yet because we're waiting for equity inclusion. Right now, we're planning on the data for January 2025. As we have a stronger understanding of the timeline, we may actually defer submission of the files until May or July. Separate from when the files start coming in, there will be a ramp up of reaching out to members and getting members to submit information. So we know that that also will occur, and that probably will take a much more significant time of just setting it up. But absolutely, if we do not have enough time, and if we can't tell you until 5 months before you need to submit, and you need to create a system, reach out to people, get their files back, build a file, and submit it to us, then we will flex that start date. So we are aware of that tight timeline. We just don't know what to say instead of January 31st yet. So we're continuing to say January 31st.
Okay.
Yeah.
I'm so a little relieved to hear that there is flexibility with respect to the submission date. So thank you.
Yes.
I will report that back to our organization.
Okay. And as soon as we have a stronger idea of the rulemaking and when we can finalize the layout and everything, then we will start talking about, okay, what timeline are we looking at? But right now, we don't want to keep shoving it down the road. So we're just pausing on January 31st, knowing that's problematic until we have more information to give you a strong date.
Okay. Thank you for the clarification.
Sure. And do we have another question?
Karen, we have one in the chat as well. Katie Walsh is asking, providers need to submit as well, correct? Separately from CCOs?
Providers are required to report to equity inclusion under their law. My understanding is that that is currently voluntary submissions. That was required during COVID-19. It's currently voluntary, and then once the repository is set up for, again, the expected date is 2027, providers will be required to submit. So one of the big advantages for CCOs, separately from CCOs, yes, one of the big advantages to have CCOs and insurers report is not everyone goes to a provider. And we need information on those people as much as we need information about people who are seeing healthcare providers. So that's the gap that insurers and then in the future third-party administrators, pharmacy benefit managers will fill as people that are either seeing a little provider, a small provider that hasn't started reporting to equity inclusion and will leave that implementation to equity inclusion, or those that have insurance but choose not to see a provider, so that information isn't coming in from another source. It also may be that depending on the confidence people have in different organizations, they may give slightly different information to different resources. They may tell their insurer data set A and tell their provider data set B. That again is one of the areas where the expertise of equity and inclusion comes in on how they're going to process the data, what priority they're going to give information, whether it's based on responses or based on the resource it came from. We are trusting equity and inclusion to figure all of that out. But we know sometimes on the simplest question, people will change their answers over time. I also do want to mention on the CCO point is that originally I thought that the one system would continue to collect REALD and SOGI information each year as people reapply or renew their application. However, because it is a federally sponsored program, it falls under federal rules for paperwork reduction. You can't ask people the same questions over and over again if you don't think the answer is going to change. And current federal policy seems to be that they don't think this information would change. I can understand why they think that for race and ethnicity, although as the categories change, information, the people's responses are certainly going to change. That seems less likely that things won't change for the disability information and for the potentially for the sexual orientation and gender identity information. So we'll see if that changes in the future, but right now we can't do it repeatedly through the one system, which is why we're reaching out to CCOs, and we will be reaching out to OHA for the non-CCO members to provide that information. Okay. All right. Any other? Oh, Chris, I see a hand up.
Yeah, so is it the intent then that we would be required to submit periodic questionnaires to members to collect this information?
Annually, yes.
Annually, but that's not currently a contractual requirement.
I'm not going to address whether or not it's a contractual requirement. I just know that the REALD law from all the way back in 2013 said that OHA is required to require its contractors to do so. So that could be something that gets pushed out for CCOs. Please talk to the contracts people for that. Valid point outside our area of expertise. Okay. Any other questions right now?
I see
Yeah,
Curtis.
I got a question. Karen and everyone on the call. So we have an expected testing period out there. Do you know when we'll be doing testing or when you'll open that up? I mean,
we will absolutely have a test period for it. We may even have a thing of, reach out to 10% of your member population by this date and give us the results to, we are expecting some members to be non-responsive. We are expecting some members to say refuse to answer or otherwise decline to answer. Those are all, the decline to answer are completely valid from anyone. We can't establish what the testing period will be until we know more about when we can actually get started. Grace, as the project manager for implementation, is getting started on the contract amendment with HSRI as our vendor to be able to receive the files and pass them forward to equity and inclusion. So we will plan on having at least a 1 to 2 month test period, at least 1 to 2 months before a file is expected. But again, it relates back to we're not exactly sure what that timeline is, but there will absolutely be a test period. Okay, and I'm sorry I can't see things better while I'm sharing my screen. Do we have any other questions?
Yeah, this is Chris again. Has a template already been created, a file format specification?
There is an existing template, and Jake, maybe I should just have you talk about this because this is an equity and inclusion area.
Yeah. So again, we do have the existing template based on the current standards, but like Karen has mentioned and Grace has mentioned, and folks on the call have mentioned, we're going through changes in the rules now. So we can begin with that simple template, but I think the end call for public comment is out now and it ends on May 22nd. So I can say, on my end, I'm preparing of like, if this is the reality, here's all the resources we can give in terms of templates, kind of data dictionaries, but because it's still unstable and some small changes can happen, we're not trying to share anything out now. But I think the focus on this conversation here is just kind of that purpose of like, okay, assuming that the template's going to exist, how are you going to get in front of your members and get this data from them? That type of situation. And I think there's one more question, Antoinette.
It's not so much a question, but I think based on what I saw of the template, I mean, the template right now, it is in draft mode, and it does reflect the changes to the existing questions. I just wanted to make sure.
Yes,
That's what I
reflects
saw.
the changes to the existing questions, but it's not finalized, so there could be some small changes away. And I mean, this is public knowledge now, so I will just post this link in here for folks to see. But this is kind of what the template looks like, kind of changes. So we're trying to provide all the resources ahead of time of, if these are the new race categories, here how the previous standards map to so-and-so, these types of things. But again, once this is all finalized through public comment, we'll have, the new attachment H, I think is what we called it, Grace. We'll have that ready. We'll have the data dictionary ready. So hopefully it's as easy as, we've discussed here of how we're going to get in front of members, and then we can give you the tools of what to get in front of them. So.
Great. Yeah, because I didn't want to, based on your response, I didn't want it to appear that what they see right now is existing when it's actually the existing with the changes on there.
Yes, yes. Yeah, thanks for clarifying.
Thank you.
Yes. Yes, and then once equity inclusion has their rules, because the question format and responses are adopted in their rules, then we'll be able to make the minor tweaks for our Appendix J, which is just really a slight tweak of language. If they're expecting numbers in the file layout for equity and inclusion, they have referred to it as numeric. If it has anything other than numbers, we are calling it text, even though the intended responses are still numeric. So anything that it has the tilde in it as a spacer between languages spoken or other areas, we won't consider that a numeric field, but we will expect to receive numbers for it along with the tilde. So that's really the only kind of changes that's going to be made between the equity and inclusion format and Appendix J for REALD for submission. Antoinette.
Okay, and I'm sorry, I'm going to be the one probably asking a lot of questions because I know I'm going to get questions within my organization. So bear with me a little bit.
Of course.
So the template that is eventually adopted by the OHA equity division will also be used, of course, for the purpose of the APAC reporting. However, when you receive that template, are you going to do the crosswalk for us and have another template where the questions are not going to be redundant with the federal questions for purposes of our reporting, or are we just supposed to use that template, although some of the questions would be redundant with on the federal side? Are we supposed to do the crosswalk ourselves? Lots of questions in one question.
So this is the place for questions, so that's perfectly fine. So for APAC, we're simply going to adopt what equity and inclusion have as their skip pattern, et cetera, is going to be what we expect in the data. So I know that equity inclusion has roll-up categories, and they're going to need to modify that for the new Middle Eastern North African category that's being adopted, although the federal government agencies have 18 months to say when they're going to start using that. But Jake, are there other resources that are available for the roll up to the federal categories that can somehow be provided either upfront, I suppose, or as a return file for the insurers?
Yes, so if you look on the website, we do have kind of how the new categories would roll up to OMB standards and how those standards would roll up to the old standards. So as Karen mentioned, the federal government actually just recently said we're changing the way we collect this data ourselves. It's kind of exciting because they're moving closer to how we collect data with REALD SOGI, but their changes are pretty significant in the fact that, there is no longer a separate ethnicity question, right? It's going to be race and ethnicity in one thing. So this change is going to require everyone's systems to update. So I feel like we're a little fortunate of, while we're in here, let's get everyone to kind of adopt this new standard is my feeling. But for specifically, we're planning on providing this crosswalk, like I mentioned, and then as those standards change, because, the federal government is slow, but they're not that slow, right? They will continue to change. We would continue to provide those resources, but there is also the option for when folks want to request data from the repository, for example, and some of the CCOs that are currently in the room know this, but we provide out, a list of calculated variables that include, okay, here's somebody's race and ethnicity according to this standard, here's the federal standard, kind of on and on. So those are specific to race and ethnicity, but we are also working for changes of, federal government standards for reporting sexual orientation and gender identity as well. So hopefully that answers, but we're trying to get a lot of resources out there because we know these are a lot of changes for folks and we all have different reporting requirements.
Thank you.
And Doris, do you want to talk a little bit about your question of the likelihood of the template being included with OHP enrollee files? Do you mean originally from one, or do you mean subsequent collection? Okay, so subsequent collection. So currently, as what's anticipated is that the CCOs, that's fine, Doris, thank you. Currently, the anticipation is that the CCOs will receive the template information, give it possibly through APAC, possibly directly to Equity and Inclusion, and then have a request to Equity and Inclusion to have returned file data. So you would not need to delete the information, the raw data from your system. But as Jake was saying, we strongly encourage people to use the processed data because, again, information comes from different sources, and we want to make sure that you have what Equity and Inclusion's expertise is determining to be the best information available to understand your membership. So that flow of information would still be available for it. We would just need to figure out what the pathways would be. But anyone who's collecting the data isn't required to destroy it once it's been transferred over to APAC or the repository, so it would still be available to you. We have this later on in the slides as we move forward about the value of using the processed data. And I believe Shiloh has a question. Did I have that wrong?
Yes. Hey, Karen. I did have a question. It has more to do with the rules, but it will determine how we would contact subscribers and members to get this data. One of the requirements in the draft language says that every time data is collected, we would need to ask for the REALD and SOGI questions if they had not already been answered within that 12-month period, like if anything is missing. So it would be, if I'm understanding it correctly, it'd be in addition to like an annual survey type thing, we would have to know that. So I was wondering if you could provide more context into what every time data is collected means and what you would expect to kind of see there.
Okay, I'm happy to answer that in question. I think it's that's a good question. And I also want to invite Jake to jump in as well for equity inclusion. But for APAC, when we say the data is collected, we really think of this as an annual survey. However, for those that have been non-responsive to the survey, those members that have been non-responsive, we would want there to be potentially 2 or 3 nudges to go ahead and provide the information, even if the information that they're providing is I decline to answer, because that is a completely acceptable response for at the member level. So if the member says, I don't want to tell you, and they tell you that in the survey, I refuse to answer, that is their response for the year. And then the following year, the inquiry goes out again to see if anything has changed for it. So that is sort of what we're expecting. So it's once a year. If the person replies and says, here's my answers, or my answer is I don't want to tell you anything, that's good for the entire year. There would not be any follow-up. If the person is just completely non-responsive and you don't know if they even, received it appropriately, then it would be a matter of sending them nudges and reminders, just like any kind of survey we have. That again is an area where we're hoping equity and inclusion can really provide some expertise about how to connect with members and have them trust that this is a valid collection document. And say if you have any questions about what's being asked here are the resources for you to contact. To try to build trust to get strong information back from the members. But if a member says, I don't want to answer, that is their answer for the year.
Super, super helpful. Thank you.
Okay. And before we go to Chris's question, I want to see if Jake has anything to add.
Yeah, I would just echo, at the end of the day, what we're trying to do is capture this information on members so it can be useful for all of us, OHA, APAC, all of you in this room to do this work of kind of identifying inequities. So, there are going to be some folks who, when they're presented with the survey, it's the same thing that happens now. They just simply refuse to fill it out. And we're going to have tools to try to, encourage this. But at the end of the day, it is, trying to get this information from your members and store it in your own systems and send it to us so we can all kind of be on the same page about who needs what and what the disparities are out there. So I think, like Karen mentioned, it's really just the intention is that once a year, if somebody's demographics is updated, like if somebody has an onset of a functional limitation, that's important for all of us to know because that could impact their services, their own healthcare, but also impact the way we're thinking and seeing disparities emerge. So that's why that once a year is pretty important there. And that's it for me. So back to Karen, or I guess maybe to Chris here.
Yes, Chris, please.
Yeah, and my question is, kind of going back to a CCO perspective. This is kind of all new, and it sounds like maybe this isn't a fully fledged process yet, but will the end product of this series of work groups be a document that explains here's the requirements and maybe frequently asked questions, or here, I think we want something that spells out here's what we need to do to comply with these regulations, and then I think we'd expect to see that in contract too if it's not there already.
So Chris, I think that's an excellent point. I do want to say that our current discussions that we're in, I consider pre-planning because again, we haven't given you the exact file layout or anything yet. Those are still being built, but because it takes so long for the state agencies as well as other large organizations to really build the resources they need to encompass something, because this is big. This is really important for everyone to have, as Jake was saying, because we need to understand the people that need services and be able to identify gaps as well as inequities that are existing currently and trying to meet OHA's goal of ending health inequities by 2030. But it really goes beyond that to understand how people's needs change over time and how they're identifying their activities of daily living separately from diagnoses we may be able to find on their record. But this is just the pre-planning stage of it. Absolutely, you will have a file layout, you will have frequently asked questions, and you will have whatever is needed on the contract side, which again is outside my area, and before you're going to know exactly what you need to be doing. And we do want to provide those resources to you, the ones that are under our control, the layout and the frequently asked questions and anything else we can provide as technical assistance for it. And we'll work with OHA, other sections about the contract language and requirements, make sure we coincide expected obligations.
Perfect, thank you.
Throughout OHA, and not have more than one track for you guys to have to deal with. Okay. So do people have anything else about how the ask will occur? Any other questions you have that you want to ask on this slide, or shall we go ahead and move forward? Again, I want to thank everybody for the questions. That's exactly what we want to have happen here. So whether it's the same individuals or different individuals, absolutely ask questions. So this is back to how will the data be received? So, it's like, how are you going to reach out to people? Then how are you going to get it back through your door? And again, Jay can talk about some resources that they may have that could be useful to you. You all may already have a web page that members can log on and answer things. And so you might be thinking, oh, we're just going to put it on our member page, send out a notice to people saying, hey, log on and answer these questions. And we will be done with getting the information back, and we'll just need to build on our end where the information is. You might be thinking we're going to do it as a mailed survey, in which case, we highly recommend machine readable rather than hiring a whole bunch of people to key information. But what all are you anticipating for the data to be received? And do you have any questions or suggestions of things that would be helpful from us? And absolutely let us know if you want Jake to talk some about the machine readable form or other things. They also have a skip pattern for the web surveys.
Yeah, so Karen, I'm sorry, this is Antoinette. I don't think we're even there yet, at least with the insurers. We are having that discussion, or trying to, within our organization. So maybe, when I know, and if we do have a third session, I can, update you. But again, we're still trying to grapple.
Yeah, and that's completely understandable, Antoinette, and that's why I refer to this as like pre-planning, is because we want to make sure those discussions are happening so that people know that they need to anticipate the resources, that once they can hit the ground running, they'll have what they need and have some early decisions perhaps made. But in the meantime, if there are questions, or there is already identified what we really need from OHA is A. It would be wonderful to hear it here, but we know this is very early in the process. And something flashed up for a comment or question.
Yeah, it's me, Karen. Hey, are we? I know this is pre-planning, but if we ever want to have like one-on-one discussions, like let's say, hey, I would like to talk to Jacob about something around this. Am I free to set up a meeting to kind of talk through some of this, or is that okay?
I will answer that for APAC, that is 100% okay, and let Jake answer for himself.
Okay.
Yeah, I'm more than fine with that. Again, I want, us all to be successful, because you all know more about your members than we do at the end of the day, right? And you know more about your systems. The only thing I would say to that, Chris, is if it's something we're discussing, I would hate other people to potentially miss out on, things we discover and share. So as long as, we could potentially invite others who want to attend on those same questions, or, be able to share back some insights from our conversation after that. But otherwise, yeah, I mean, I'm here to make this project as successful as we can. So,
okay, thank you.
Yeah, and absolutely the same for APAC. And that's one of the reasons we put the APAC admin email in, is because people might say, oh, I should have asked this question, but we're farther along than when you were having these discussions. But now I know I need to ask this question. Send it to us. And we will continue to build frequently asked questions and different topics for it. If we need another round of these discussion groups after more is known For the implementation, we're happy to do that. This is not a, hey, we gave you 4 discussion groups, we're done with that. We want to support it throughout the implementation process and then really beyond. As I am anticipating some of the members will be reluctant to reply, or some organizations may realize, hey, this is really useful information. Tell us again what we need to do to get the information back out so we can address health inequities within, or even have a better idea of our member demographics to plan services in advance. We're in this for the long run. So. Okay. So the next one is, where will the data be stored, and that is relevant to how will the data be used at the organization other than sending it to APAC. This is just a gratuitous reminder that when you develop the tables, if you're planning on using the information, please set up analytic tables, because we don't want to receive the results of your analysis. We want to receive the raw data that you receive. If you want to analyze the raw data, or if you want to request a return file from us, so you would be planning on setting up an analytic table, please have that be separate than the data storage that you have the data that's returned from the member in. So are there any questions about data storage? And again, this is quite a few fields. You all deal really with mega data, but having a new set of 70 to 80 questions with multiple answers come in is still something to plan for. So Shiloh.
Hey again. So I did have a question. It may have gone better for your question before, but I was interested in just kind of learning more. I'm right there with Antoinette, where we're really learning and trying to figure out what our options are for conducting these surveys. And when I'm looking at the template that was provided, the draft template, and looking at some of them, like for home language, there was, it looked like if I looked at it correctly, like some of them had over 70 options, some had over like 8,000 different language options. I was wondering if y'all had experience with how you ask that and how you determine which ones to do, because that seems like they would not all have been included up front, possibly. That may be a bad assumption.
Jake, please answer. And Shiloh, I'm with you. If I was receiving a survey, I wouldn't want to go through 8,000 different languages. So.
Yeah, that's why we're saying no paper templates, right? Because you send them a phone book of languages. But I'm just joking. So one thing we do is, for some internal surveys, we have it kind of set up in a way where it's a kind of quick read. So if you're typing a language, it kind of does a smart read of say, okay, this looks like English, we're going to map it to these fields. So that's part of what we do within the one system, for example, is when somebody's entering their language, it's a write-in in the sense that it'll end up getting mapped to it within the logic of the survey. So that's why we do provide those codes of, if somebody's entering this, it's kind of a smart lookup, I believe is what the technical term for it is. The other thing we do is, if folks do write in languages, we have stuff set up within the repository, for example, that is, mapping that kind of open text of, there's a lot of ways you can spell English, let's just say that, but that is one tool we use. But as much as possible, we try to set it up in a way where these are all referring to some type of code or some ISO code with the language. That makes sense.
It does. I'm wondering then, would we report to you exactly as the member reported it to us, and it would go through your repository for that, or are we needing to, or would you expect us to give you the cleaned up version?
I would say sending us what the member reports, but doing as much of the kind of front end logic in place to try to make sure what the members reporting on is coming from one of these predefined, 7,000 language categories, for example. But for the case where the languages they provide do not match, just sending us what they have. And then for these other open text responses, is some folks are going to put in, race and ethnicities that are not on our list. They might be on a CDC list or something like that, but the intention is really, the direct response from the member with as limited editing as possible, if any. So hopefully that
Gotcha.
covers that.
Okay.
Yeah, thank you.
So, and Jake, could you talk a little bit about how that would be different if they had a machine readable paper form that a member was sending in compared to they have a website that members are logging on to?
Yeah. So it is tough when it is a paper form with, some of these fields. So the machine readable can be really helpful if, the categories they're putting down do match as much as possible. But I think the pieces for the open text, right? Like if you treat it as just a string, we're just throwing it in there. But that is why we do encourage as much as possible these kind of web forms, because the logic that can be put in place reduces the amount of variations of saying the same thing and all the processing that's necessary. Does that kind of address your question, Karen?
Yes, I think so. It's just,
Okay.
one of the limitations if we do it paper, then yeah, the interpretation is going to occur well after, and you're only going to have what they chose to write in. Because we would not expect you to give a paper form with 8,000 language codes for them to mark through for it.
Yeah.
So,
Yeah.
okay. Any other questions or comments about data storage or use after the fact, where you have an analytic table separate from the raw data that you've received? And definitely one of the things it sounds like that would be useful, and we will plan on providing as best we can, is potential shortcut edits. I mean, not changing the information, but if they have typoed English, this is what we recognize as the different typos of English, and you're fine to report English to us. Yeah. So I'm going to go ahead and show the resources screen. This is the third one that I'm always going to have in there. We have our implementation page. We have the equity inclusion REALD and SOGI page available. We'll post these so you can grab those links as well. And then, as always, the presentation that Kwaku Wilson did for the January Technical Advisory Group meeting, the APAC Technical Advisory Group meeting. We know there are many out there. The draft Appendix J that we know is going to need to be updated, and we will update that as soon as the rules are final for equity and inclusion, and work with equity and inclusion to make sure that we haven't unintentionally altered anything from what they're expecting. And I think that is it. And then the next thing is just, questions, comments, concerns. Anything else people want to ask about today? And since we've been able to go through these questions, if you have a question about last time or what you think the next topic is going to be, you can certainly share anything on the continuum of REALD and SOGI implementation. Antoinette.
Yeah, just wanted to thank you a lot for these sessions. They've been very helpful to myself and also some of my reps on this call, and it will be helpful to our organization. I will just encourage that you continue these sessions, especially once the rules are adopted and there is, we enter into our next phase, which is kind of putting all of this into action. So thank you for these sessions, and I really encourage that you continue them until the submission date, which hopefully is pushed back to later in 2025.
Yes. Thank you, Antoinette.
Mm-hmm.
Yeah. Chris.
Yeah, sorry. And what was that original submission date?
January 31st, 2025, which would cover 2024 data.
And I guess that's if collecting that data is not currently a contractual obligation for CCOs, how will we have that by January 31st, 2025? Or will we be expected to collect that in January and submit it by the end of January?
No, I don't think it'd be a matter of we expect you to start the work at the beginning of January under the new contract and submit it by the end of January. And I know you were pointing out how unreasonable that request would be, and I'm agreeing. That would be totally unreasonable to expect. So we will, have some internal discussions about who we need to talk to about the CCO contracts and what can happen under the contracts and what the timing of that might be to provide the CCOs with better information, Chris, for it. But for all insurers, I think at this point, again, we don't want to change the dates because we don't have a solid idea of what the dates would change to. But if we can't give you at least 6 months notice about the need to collect the data and produce it in a file, we would push back the date. And that seems pretty certain right now. We just don't know if we would be pushing it back to May or we'd be pushing it back to July. Again, often like when we did the dental files, for those of you that were with us when we did that, we originally thought we were going to start collecting them in January. We pushed off collection until July. We actually required the files that would have been due in January to be submitted along with the July files, July 31st files, because of the desire to have the previous year's data. This data is much more of a point in time. So if we're not able to provide if we're not able to collect data until the 2025 reporting period has started, that will be the data that we're expecting. We would not ask people to say, oh, go ask them about 2024 and then go out and ask them about 2025. No, once per calendar year, ask them the questions. So if we delay the time period, which again seems likely, but we don't know until when, then we would be wanting a point in time for the current information. So there's no going backwards for this type of file. Other questions or concerns for today?
I have a question, but it's more, I guess I'm trying to visualize this, is that, so generally speaking, once a year, we're going to be collecting REALD and SOGI data, submitting through APAC, right? So are we generally speaking, like reaching out once a year to our members, or is it our job over here to just continuously collect this over time? Aggregate this data, save it somewhere, and then, hey, the submission comes up, we just point it, take back. Is that, in a nutshell, visually what we're doing?
Right now, APAC's expecting quarterly files. But if you've already reported on someone, and we're still working with equity and inclusion on this, if we start July 31st for submissions, and the July 31st submission, you report on Karen Hampton, and this is the real SOGI information on Karen Hampton, then we would not be expecting necessarily, well, we certainly wouldn't be expecting different information in the October 31st file, because it's still within the same year. We might be expecting you to resend Karen Hampton's information, even though it hasn't changed, or we might say, okay, you already sent Karen Hampton's information, just send us anyone who's replied to you in the last 3 months, and then the 3 months after that. One of the things I want people to think about is if they want to have a staggered approach to sending the information out to people and receiving it back for the first year and then set that up. It's not a matter of you need to ask everybody at the same time this question, because some people are going to come on into your program 2 months after you've sent the question out to the standard members or to the existing members. Then we would expect you to ask them within 2 to 3 months. We may have that enroll. And then send us their responses once they're in. So it's still chunking it for it, but it would not be continuous. It's like, I'm asking you for a year, and then we're storing that information for a year, and then we're asking you for the new year, and we're replacing the information. You can store it if you want, but we would not expect you to store it and compare it to the previous years. So we're replacing your information with this, and then the next year. So it's jumps as opposed to continuous. If someone is non-responsive and they don't even tell you, I'm not going to tell you, then it'd be a matter of, 6 weeks to 2 months later say, hey, we still need this information from you. It's really important. Here's why equity and inclusion of the Oregon Health Authority says it's useful. And be able to, try to get that until they send it in. And then once they send it in, that sets the date for the annual. You wouldn't send it back to them if it takes them 6 months to get it into you. You don't have to then ask them 6 months later because it's a new calendar year. You can wait until the year rolls and ask them for new information, because we don't want people to be badgered with this information, but we do want them to understand how important it is. And also many of us say, oh, why would you ask every year? It's like, well, there are things that change from year to year. The one thing that's probably going to change for all of us is the disability. Primary language probably isn't going to change, but people might be comfortable with giving a different answer. But there are some things that do change over time. So, but we only want to ask people once every 12 months. Hopefully that was responsive.
And this is Antoinette again. I would love to actually see that concept of how this once a month submission or collection. Yeah, I'm sorry, did I say once a month? Once a year. Data collection and submission, would work. If that can be included in the FAQ, that would be really great, because I was trying to kind of visualize this step by step, and I think I lost you along the way. I'm used to annual reporting with the state on other stuff. Yes. And when we mean annual reporting, it's like once a year and then that's it. But I see that there are variations within this required reporting and submission. So if at least you can include that concept in that FAQ, that would be very helpful in explaining it to my organization.
Yep. That sounds great, Antoinette. And really, one of the reasons we have this as a quarterly file, even though we consider it annual information, is if someone doesn't respond, they're a little late responding, we don't want to miss their data for an entire year. We want to get their data in as soon as we can. And the first thing that jumps to my mind is have a date in your data tables that says this is when they responded, and set up a particular file that says, okay, so 11 months before that date, we're going to send out a request for new data, or 12 months even from that date, we're going to send a request to the member for new data. But we can absolutely talk about that as people get things designed and make sure that we're sharing as much information as we have on what that would look like.
Yeah, because I'm thinking for us, it would probably be more relevant for the new enrollees members that we get, for us to include that in the next quarterly submission, right?
Yes.
So, yeah. Okay.
Okay, and I think there was one other question or comment, and I'm sorry, it flashes up and then disappears from my view since I'm sharing my screen, and maybe I should go ahead and stop sharing it.
Yeah, I can take this question. So there are REALD SOGI questions that are designed for everyone to be asked. Often it's times, parents reporting on behalf of their child, but within each question, there is age-specific skip logic. So, if the child's above age 5, we're not asking certain questions. If somebody's below a certain age, we're not asking other questions. But I believe the core of it is if you're a child that's under 5, the questions that are asked are generally related to race and ethnicity, and then functional limitations around vision and hearing. I think those are the 2 questions. But if you look at that proposed template, it does include all of the age-related skip logic. Hopefully that answers your question, Chris.
Well, this is Karen. I'm really excited. I'm really excited that we had questions up to 11:59 today. If you have additional questions, absolutely, share them with us. You've got the APAC admin email. We will have another meeting in, I think, just a couple of weeks on the creation of a file and sending it into us and what that might look like. So there might be more questions there about, edits and other things that would be filled in. Is the annual collection based on the date they respond or when we first sent the survey? That is certainly something for us to address. My initial thought is when they respond. because they're getting information as a snapshot, as opposed to it's your obligation to ask annually. But that doesn't mean if it takes them 8 months, you ask them 4 months later. You base it on the 8 months for it. But we can absolutely detail that out in either rules or frequently asked questions so that people feel really confident in the information they receive, which today it's mostly, well, we're going to try to do this. We're thinking about that. Let us know about this. And I understand this isn't a real confidence building exercise. It's more of an exploration of what kinds of things do we need to develop. But we will absolutely have frequently asked questions, a strong file layout, and any other instructions that are needed, and coordinate throughout OHA, equity and inclusion, APAC, and the contracts with the CCOs. Anything before we sign off today? Okay, well, thank you all for attending. I really appreciate it. I love all the questions. I love hearing the things we need to figure out because it gives us time to figure them out before you need them. So all of those are greatly appreciated, and thank you all.